It started with a football player, Fred Hill, and he had a daughter, Kim, who was being treated for leukemia over at St. Christopher's Hospital. He was actually directed to go see Dr. Audrey Evans, who is our founder, who was just setting up an oncology program over at CHOP. So now they have to raise the funds. And that's where the McDonald's organization came into play. And they put their heads together. The next promo menu item was the Shamrock Shake. And it was determined that the Shamrock Shake proceeds could be given to fund this project if their beloved mascot would be associated with the project. So that's why they're called the Ronald McDonald Houses. They did raise the funds. We opened back in 1974 in a little row home with 7 guest rooms with a host family, and it's been expanding ever since. The criteria to come here, none of it is financial, okay? Because a poor person or a rich person needs the same type of support. Family must live 25 miles or greater away. The patient must be 21 years or younger. So when they turn 22, that family wouldn't be able to stay here. And many of them do have financial issues going on. You know, medical care is very expensive, and so we try to house them. We ask that they pay or give a donation of $15 a night to stay here, but about 40% of the families that stay here can't donate that money, so they stay here for free. We try to feed them as well, so we have a hot meal for them every evening. Breakfast foods are available to them to make their own breakfast during the work week, and any leftovers of the dinner the next day are put out for lunch. So we feed them, and then we transport them as well. If they don't have a car or they flew in, then we have donated shuttle vans and that we transport the families over to CHOP 6 times a day, and then down to the Center City hospitals. We could do that up to 3 times a day. So it's not a bad place to stay. It's sometimes a shock when they have to go home and start cooking again. But while they're here, we try to take away the daily living struggles so that they can focus on what's going on with their child at the hospital. Well, I'm passionate about families and children, so this is the perfect place, because when I'm done interviewing with somebody or setting up talking to a donor, I can stop and have a conversation with a little one, hold a baby, talk to mom, you know, and understand, you know, that providing this house and the meals and having volunteers here to help keep this place running is very much needed and appreciated by the families. So it's always a good feeling.